Welcome back to the Means Report. We appreciate you staying with us. Thanks again to Dr. Carbone for giving us such great information about her study. I really hope that people watching are able to take advantage of that. And as she said, be pain-free one day. Wouldn't that be wonderful? Another thing that is wonderful that is going on at Wellstar MCG at Augusta University is the effort to make sure that women who need OB care get it, no matter where they live and no matter how limited their access to a healthcare facility may be. And a gentleman who is helping to make sure that happens is joining me now. He's Dr. Matt Lyon. Matt is the director of the MCG Center for Digital Health, also a professor of emergency medicine. Thanks for what you're doing for these women, and thanks for being here today.
Yeah, thank you for having me.
All right, so the first thing I noticed when I was looking at your title was that you lead the Center for Digital Health. That sounds like something that may have been born from the pandemic. Is that accurate?
Well,
and what is it?
The center is part of MCG, where we do education and research when it comes to telehealth and telemedicine. And partnering with Wellstar MCG and Wellstar generally, we are able to provide services across the state of Georgia through digital means, telehealth, digital monitoring, those kind of things.
All right, so go back to the pandemic, and since March of 2020, have you seen an increase in more patients going, you know what, maybe I don't need to drive to the doctor, I'm just gonna FaceTime him or her?
Well, we began telemedicine actually a couple of decades ago, and it's been expanding, but the pandemic had an interesting effect on digital health. What it did is it allowed people to be exposed to it, and then it became an acceptable means of obtaining health care. And what we were doing during that time was expanding our rural services to get people in rural hospitals tied to our academic medical center for specialists they wouldn't have access to otherwise. And so the pandemic allowed for us to create what we call the Digital Care Network, which is 19 rural hospitals across rural Georgia that are tied into Wellstar. And we're able to then tie in emergency physicians, critical care physicians, OB physicians, infectious disease doctors, all kinds of specialists, so that those patients don't have to transfer or travel from those rural hospitals or those rural counties to Augusta, and yet they're still seeing that specialist and getting that specialty care.
All right, let's talk about this grant that is helping make the OB expansion in telehealth possible. Where did it come from? How much is it? And how will you spend it?
Well, it's a very interesting grant. So our rural network tells us where the gaps are in rural healthcare. And so one of our hospitals said, you know, a lot of our hospitals have given up delivering babies in rural Georgia. And so moms have to travel a long ways when they have an emergency. And as you know, an emergency, time means a lot.
Yeah.
So we began exploring that, and we found out that there were some simple things we could do beyond what we already do about tying our specialists into the rural hospitals, providing some equipment, providing some training and guidance and protocols. And so we embarked on creating what we call the OB network, or the Tele-OB network. And what that means is that we're tying our rural hospitals in to see our emergency OB providers 24/7, 7 days a week through digital means. But we're also giving them some equipment so that we can evaluate mom. And we're giving the ability to tie that back into our electronic medical record so our specialists can see that just like they were standing next to the patient.
Okay, so let me go back to that, because I think we really need to make this clear. It's the rural physician talking to the physician on the other end.
It is, and our physicians can see the patient, so you know, they can build that patient-physician relationship, but we work in conjunction with the physicians and the clinicians in those rural hospitals.
Okay.
And so they are key partners. So it's clinician to clinician talking about that patient, and that patient's getting tied into the specialty services they need, getting those specialty tests read, getting those ultrasounds done remotely, so that maybe the mom doesn't need to transfer, or if there is an emergency, that it's expedited so they can have the best care possible.
Is there ever involvement by the patient in that telehealth experience? I know you mentioned it's doctor to doctor. Can the patient go, wait a second, you know, you forgot that I'm feeling this right now?
Yeah, that's the beauty of this, is that it's almost like beaming in the room like we're here on TV.
Yeah.
And so they can interact with the doctor there, the doctor on the digital means, and they're able to review test results together and make a cohesive plan that's patient-centered.
All right, you've alleviated my apprehensions about telemedicine as far as, you know, they can't physically touch me. They can't look at my issue face to face when you're doing telehealth. What would you say to anybody else out there who might say, look, I don't care what you say, I will never not physically go to the doctor because I don't trust those cameras?
Well, again, this is a special kind of digital health where there's a clinician there taking care of you in person, looking you face to face, able to touch you, take your blood pressure. You have a whole team there in the rural hospital from nurses, pharmacists, doctors. What we're doing is bringing in that specialty care. So bringing in that added bit of benefit so that you don't have to have any ambiguity in your care. You don't have to transfer and go see that person face to face. So it's really a beauty because it's getting the right care to the right patient at the right time in the right place.
How long, let's just stick with pregnancy, how long during the duration of a pregnancy can this sort of virtual relationship go on? Is there a time where you cut it off completely and say, ma'am, let's get you to the actual doctor?
Well, again, so the program we have is we can do this 24 hours a day, 7 days a week to our 19 rural hospitals with any clinician.
Sure.
For OB specifically, what we want is for those rural providers, when that mother shows up in the emergency department, to say, I think an obstetrician could help fill in some gaps to help provide a little bit of better expertise and tie into that network so that our OB provider is helping take care of that patient. Because there's many of our counties that don't have an OB provider. And while they have good primary care physicians, they may even have some emergency physicians, they don't have that OB specialist. So this is bringing that OB specialist into the room to make sure they're getting OB specific care.
So would that OB specialist, for instance, be able to observe an ultrasound while it's live, or would he or she just get the film of it later, but live and say, okay, here's what I'm seeing on my end. Does that happen?
Yep. They can look through the digital means. They can help guide the ultrasound. So if they're looking at something specific for what that mother came in for, they're able to see that and get that real time. They're also able to evaluate the mother with that bedside ultrasound. So it's even more powerful than just getting the images coming back in your chart, because you're able to ask mother questions about what you're seeing. Is this where you're hurting? Is this a problem? How long has this been going on? While you're seeing inside their body.
Dr. Lyon, I think you mentioned at the top of this interview, maybe 19 rural hospitals that can be connected via Wellstar. How do you determine the need? How do you know, hey man, this area is underserved? Is it just all looking at numbers, data?
Well, I mean, from what we're trying to do, we'd love to tie in every rural hospital in Georgia. We're about a third of the rural hospitals in Georgia are tied into us. But, rural hospitals in general have needs, and what we bring to them is a menu of services, a menu of specialists, if you want to think of it that way, where they can have easy access to the care that they need, the specialty services they need, without having to travel to Augusta or Atlanta or wherever. Staying in their rural communities is really important for us, helping keep people in rural communities, decreasing the burden, cost of care, helping them with their chronic diseases, helping them in their acute emergencies. It's really what we're trying to do.
Just from a technology standpoint, how clear is the telehealth connection? Is it just like, super HD, or does it buffer like sometimes we experience at home?
Well, we always hear about the rural broadband issue, and that is a problem. However, these are in the hospital. So our hospitals are digitally connected. They have really good internet service. And so our 8 and 10K cameras, we get really good images.
Does insurance kick in for any of this? Does it need to kick in for a virtual visit? Kind of walk me through that. That's a concern.
Yeah, so, in Georgia, we have really good state legislators that have made telehealth really good, because we have an enormous state and digital is one way to reach all of our populations.
Yeah.
And so they've made it very good. So we're able to bill for our services when we see that mom. The rural hospital is able to bill also. And the mother is also saving money, because oftentimes she would have been transferred and had to come, an hour, 2 hours to Augusta or Atlanta or Macon, and then had to get back home.
Right.
And so actually this decreases overall cost of care for both the state, but as also to the patient.
How secure is it? Should I be concerned that during a virtual visit, when my doctor and the doctor on the other end are discussing my private information, someone's going to hack into it?
Nope. This is all secure, HIPAA secured. digital means, and the way that it works is that it's coming through the hospital as a hospital-hospital connection, so nobody can tamper with it.
Can I ask you just a couple of general questions?
Yeah.
And I appreciate you walking us through the OB telehealth push. I hope it continues to go well. But what about ultrasound? You know, we talked about it during a woman's pregnancy. Are you seeing ultrasound technology used to diagnose other issues in the human body? And if so, what can it do?
Absolutely. So point of care ultrasound or ultrasound at the bedside by a clinician is something we've been doing for almost 2 decades at MCG, and we're able to tie that into the rural hospital. So we provide them with the equipment. It comes through that same digital network, and so we're able to see those images live. You know, our grant was part of a USDA grant. It's also provided ultrasounds for rural hospitals as well as the digital communication, and now providing this OB-specific equipment. We also had the Georgia Community Foundation, which gave us a grant that really helped us leverage the USDA. The interesting thing about federal funds is oftentimes you have to have a match.
Yep.
And so the USDA provides 85% of the money you request, and we used the Georgia Community Foundation for the other 15%. So we took their 15% from Georgia and multiplied it. And so we're able to provide, this grant's about $450,000 of equipment for rural hospitals. And we've been able to use some other foundation funds to get that to what we really need to do to equip Georgia's rural hospitals.
Well, I hope that you are successful in that effort. I know you will be. And on behalf of the patients out there and the doctors who benefit from it, thank you for what you're doing.
Thank you.
Absolutely. Dr. Matt Lyon, MCG, a wonderful effort going on right now to expand healthcare and improve it to those who might not be super close to a doctor or a hospital. When we come back, we will tell you how to stay in touch with us here at the Means Report and help us get more great guests like Doctors Lyon and Carbone when we come back.